Okay, so the first thing you're going to want to do is to iron out the quadricep muscles, these four muscles through the front of the leg, and in particular this big one through the center called the rectus femoris. So in order to do this, I would recommend getting something like this, which is just a roller that's got some ball bearings in here so it spins. You're going to put some good pressure. You're going to work all the way from the top of the leg here up near the hip all the way down, and you're going to go very slowly. So just about this speed. Now I want you to use pressure that's tolerable. You don't want to use pressure that's causing pain, that's going to induce any kind of new trauma to that area. What you want to do is use pressure that's maybe a good sore at most. And you want to go very slowly to iron these muscles out. Now I'm going right down through the center here, so this is focusing more on this rectus femoris. And I'll also mention that if you don't have access to a roller like this, you could use a foam roller on the ground where you're laying on top of it, rolling back and forth with your leg. You could also use something like a stick, like say for instance a broom handle or something like that, and just let it kind of roll through your hands, or roll it through your hands as you start to roll it down toward the knee. Now you're going to roll from the top of the thigh down to just above the kneecap. You don't want to go onto the kneecap or even too close to the kneecap here. So I'm going to stop right about there. Now I would do a couple more rolls like that through the center. Then I'd also come through the inside. I'd work through the inside, starting up high here, and I'd work all the way down to the inside of the leg. Same premise here. You don't want to traumatize the muscle. You want to go slowly. You want to work with pressure that feels like a good sore. And the other thing is, as you're working through these areas, if you find a particular spot that feels real tender, hang out in that spot, take some deep breaths, maybe slowly roll back and forth a little bit in that area and try and iron it out a little bit more. When you're taking the deep breaths, you want to imagine that you're breathing into the area that's really stuck and tight. As you breathe out, you want to imagine that whole area just relaxing and opening to the pressure of the roller. So I would go all the way down to right about there. The last spot I would do is along the outside of the leg with the roller here. Again, all of these can be replicated with the foam roller. And again, right through this IT band, this iliotibial band along the outside of the leg runs over the top of one of your quad muscles, and it ties in near the kneecap. When it gets very tight, what it can do is pull your kneecap off its normal tracking and cause some pain either on the outside of the knee or the inside of the knee. So rolling this out is really important. Again, you're going to find some tender spots, especially through this IT band. It's got a lot of nerves in it. When you find those spots, remember, take the deep breaths into those areas, try and relax into that pressure, roll back and forth a little bit, try and iron it out some more. So I'm going to come all the way down to right about here, just like so. All right. So now that we've rolled out and basically ironed out inside, outside, and top of the quadricep here, what we're going to be doing is using some lotion, and I'm going to have you manually use your fist, and you're going to be using your knuckles, which allows you to actually get into the belly of the muscle more, as opposed to just that broad pressure of the roller. So when you get into the belly of the muscle more, you're going to find more tender spots, more adhesions and things like that where the muscles are glomming on together. So you're just going to massage in through this area like so, just like that. So I'm going to just focus on this rectus femoris muscle. This is the most important muscle for doing knee rehab. The reason is when it shortens and when it's traumatized and it shortens up, it tends to pull the kneecap up, and it makes it very difficult for you to bend your knee. So from this spot here, what I'm going to do, okay, so now that we've ironed out and done some general opening of this area, we're going to focus in on just this muscle of the rectus femoris. Very important, because when this muscle gets tight and shortens, it pulls and yanks your kneecap up, and it starts to irritate the tendon underneath here and makes rehab a lot slower. So what I'm going to have you do is take some lotion. You're going to put some lotion on your hands here, put it onto the thigh here, and we're going to, basically I'm going to be using this line of the knuckles in order to get deeper into the belly of the muscle and break up any adhesions that are in there. So what I'm going to have you do is lift this elbow up like so. You're going to put the knuckles right here at the top of the thigh. You're going to take the other hand and put it right at the wrist to help you push down into the thigh. Remember the rule of thumb on this, you want it to be a good sore, not painful. And I'm going to just very slowly start to slide down through the front of the leg here. Now, because you're doing this kind of pressure where the knuckles can dig in a little bit deeper, there's a greater chance you're going to find some tender spots. Again, when you find those spots, hang out, hold some static pressure, take some deep breaths, try and relax into that pressure. See if you can't let your knuckles here go and sink a little bit deeper into that tight muscle. And you're going to go just again about this speed. The slower you go, the deeper you can go. If you start speeding up, your muscles will tend to want to tighten up to try and protect against that. So nice and slow through this area. You can always lean your body weight into this a little bit too if you don't have the muscular strength maybe in your upper body to make this semi-easy for you. And we're going to take this all the way down to the same spot as with the roller, and that's just above the kneecap. Just like so. I want you to do that 3 times. If you have the time, do it 3 times. If you don't have the time, I would actually skip the roller and just do this. This is the most important. The roller helps to generally release inside, outside, and top of the leg, but this is what really gets deeply into that muscle. So the next thing that we want to focus on after that is we want to get into the tendon right here. So this is the tendon of this big rectus femoris muscle and attaches to the kneecap. This tendon can get really fibrous and shortened also. So what we want to do is we want to give it some what we call cross fiber friction. The tendon runs this way, so the grains of the muscle and tendon run this way. We want to go across that. So again, you're going to take your knuckles here and you're going to rub back and forth. Now that you've got some lotion on here, it's pretty easy just to rub back and forth. It might be a little tender in there, a little nervy. And notice I'm just above the kneecap here, so I can feel the cap. I'm going to go just a little bit above it and work kind of in that little gap. And so just back and forth like this. I would do this for about a minute. Back and forth. If you find a spot that feels especially tight, you can work a little bit harder. Same rule of thumb. You don't want to create pain. You just want to roll out any area, rub out any area rather, where it feels like it's really tight and kind of solid in there. Now, in general, okay, so now that we've used the knuckles to go down through the rectus femoris, through the front of the leg here 2 or 3 times, what we then want to do is work on this tendon just above the kneecap. So the kneecap sits here, tendon's right here above it. What we want to do is you're going to take the knuckles again, and we're going to do what's called frictioning back and forth across the fiber of the muscle, or in this case, the tendon. So I'm just going to use kind of light to moderate pressure and scrub back and forth with my knuckles like so. It might be a little bit tender in there. You just don't want it to be painful. That's fine. You're going to do this for about a minute. What this does is it helps to break up any kind of adhesions between the different fibers of that tendon, where they've kind of gotten glued on, gotten sticky and hard. And we want to make this more flexible. We want it to be more stretchy. So you're going to do that, just like so. Okay, so now we've done all of the rolling. We've used the knuckles to get through the front of the thigh here. We've done some cross fiber friction on the tendon. Now we want to stretch the tendon now that we've gotten some of those adhesions broken up. So to stretch the tendon, since you have some lotion on here, if you try and pin that tendon and then bend your leg and try and hold that tendon in place, it's going to slip. So what we want to do is actually, you're going to take a rag or a towel, anything like this, maybe in this case a pillowcase, and I notice I'm putting it just above the kneecap here. I'm going to start with my legs straight. I'm going to take my fingertips and put them behind my knee as pressure back there so that I can push down with my thumbs. I'm going to push really hard with my thumbs because what I'm trying to do is I'm trying to stretch this tendon out. So I'm pinning one part of the tendon, and I'm going to slowly bend my knee here. I'm bending my leg, and I'm going to have my foot a little bit above the ground so I can continue to bend. Now you will feel maybe a burning sensation in here. That's stretching the tendon out. And that's what we want to do. So you're going to bend as far as you can of your own power here. Now you may not be able to bend as far as I can, that's totally fine. And you're going to just hold really tightly with those thumbs so that none of that tissue, none of that skin or anything is sliding underneath. And you're going to go ahead and straighten it again. Go ahead and bring the towel, or in this case the pillowcase, down to that same spot again. You're going to again push hard with those thumbs. Hold that nice and secure as if you're tacking down just that one end of the tendon, and then you're going to go ahead and slowly bend again. And you're going to actually do this 3 times. Very, very good exercise for starting to get your kneecap to be able to glide better. Just like that. And straight, and you'll do that one more time. Now once you've done that, the last exercise I'd recommend for you is something called heel glides. Now heel glides require that you have a yoga strap like this, or a belt, or a rope, anything to tie around your ankle. So I'm just going to cinch this up like so. I'm going to lay back down, and I'm going to bend my leg as far as I can. So maybe you can only go this far. Notice I've got the other end of the wrap, or the strap in this case, in my hand here, so that I can pull. And what I want to do is slowly pull my foot up toward my butt. And this is a way that I can work on my range of motion without needing anybody else to be pushing. So as I do this, I'm going to eventually reach a point where I'm either going to have maybe some tension, pain, some discomfort, maybe the back of the knee, maybe the top of the knee, anything like that. So you want to bring yourself just to that point, just to the edge a little bit, so you start to feel that discomfort a little bit. Once you do that, we're going to do something that's called strain, counter strain, or contract, relax. From this position, what you're going to do is you're going to hold this yoga strap or belt that you have in your hand nice and firm, and what you're going to do is you're going to push with your shin, with the front of your leg, as if you're going to straighten your leg like this, but you're going to hold this nice and tight. So I'm going to push just with about 20% of my strength, as if I'm trying to straighten my leg. And obviously my leg can't go anywhere because I have the strap attached to it. But what that does is it contracts all the muscles that we just relaxed to the front of the leg for just a moment. You're going to do that for a count of 5. So 1, 2, 3, 4, 5. You take a deep breath. As you breathe out, you try and pull this up, pull that heel up toward your butt just a little bit more. You should be able to get a little bit more bend in it. So you're going to do this 3 times. The reason for this is that we're teaching these muscles, now that we've opened them up through massage, through pin and stretch, and through cross fiber friction, we now want to teach them how to stretch farther. So once you've gone through all the other stuff, go ahead and do this exercise, and I think you'll find that you can get some more bend.